Mothers are dying here at higher rates than mothers in any other.
Women in the United States are dying from pregnancy or childbirth-related causes at an alarming rate.
In 2021, 3,664,292 newborns were welcomed into our world here in the United States. Though the number of small gifts are large, our country is still at a steady decline in birth rates. On the contrary, there was a 40% increase in maternal deaths from 2019 to 2021. In 2021, there was reported 1,205 deaths due to maternal causes. According to the report by the Department of Medical Assistance Services, the maternal mortality rate in Virginia in 2020 was 15.6 deaths per 100,000 pregnancies. Cardiovascular disease was found to be the leading cause of pregnancy-related deaths in the United States. According to the CDC, between the years of 2017 and 2019, 84% of all 1,018 pregnancy-related deaths in a sample collected from 36 states were determined to be preventable. As a group, this led us to questioning if most cases of maternal death are preventable, where is the disconnect in patient treatment? Throughout most of this experience, our team ran into difficulty in finding large-scale data sets or uncovered inconsistent reporting mechanisms across state governments. One example stems from the Texas Department of State Health Services 2022 Maternal Mortality and Morbidity Biennial Report. The CDC describes severe maternity morbidity as an unexpected outcome of labor and delivery that leads to a short or long-term consequences to a woman's health. Because the majority of untreated conditions identified could result in death, SMM indicators on a hospital discharge papers are used to help report mortality rates and ratios. In Texas, however, an enhanced method was developed that completely goes against the grain and guidelines provided by the CDC. This has led to an underreporting of mortality rates for the state. Another part of our journey included investigating the racial breakdown of maternal mortality in respects to race. As you see in the graph in front of you, women who are African American display a much higher rate in death in comparison to other racial groups. According to the CDC, these numbers can be explained by factors such as variation in quality of healthcare, structural racism, underlying chronic conditions, as well as implicit biases. So, how do we move forward to fight against the increasing rates of maternal mortality? Step 1. It's important to produce more training and encourage medical staff to listen to more African American patients on topic of pain and pregnancy. The process of pregnancy is difficult. A mother should not have to receive unacceptable medical assistance just because the color of their skin or preconceived medical biases one may have. Step 2. There needs to be some form of centralized reporting standards across all U.S. states. Step 3. We want to create a platform at the tip of one's fingers that enables women to find and create circles and safe havens for asking and answering questions, along with connecting with others' stories. The platform would also provide telehealth services for women at either reduced or no cost. Regional resources will easily be detected for each user based upon GPS location. Last but not least, we want women to have a bank of health-related knowledge right in the platform. Health articles will provide extensive research in an easily digestible fashion for users. A quote from Melinda Robinson, an American nurse midwife who has spent over 30 years working in women's health, resonated with our group during the analysis. She shares, "This is not a rare disease, this is pregnancy. It's a normal condition that 80% of women will experience in her lifetime. All women deserve a safe space and respectful way of giving birth. It's a basic human right." Our group may not have all the answers. However, today, we have provided some initial actions to be considered in helping to reduce the alarming rates of maternal mortality. We all need to take charge and change the status of women's health. Thank you.